Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. This week, President Obama nominated Dr. Robert Calif to be the new FDA Commissioner, succeeding Dr. Margaret Hamburg, who stepped down in February. Dr. Calif has served as the number 2 person at the agency since January and has been viewed as the likely nominee since Dr. Hamburg's departure. A cardiologist, Dr. Calif has spent most of his career in academia, most recently at Duke, but he has served on FDA panels for several years. Cancer drugs are driving growth in the 340B discount program more than previously thought. That's the key finding of a new report sponsored by the Community Oncology Alliance and prepared by the Berkeley Research Group. The report, released this week, confirmed findings from the Government Accountability Office that a program intended to help safety net hospitals has expanded too quickly in recent years and is pushing community oncology practices out of business. The report showed how buying up oncology practices to make money off cancer drugs has become a business strategy for some 340B hospitals. Ted Okon, Executive Director of COA, called cancer drugs the pot of gold at the end of the rainbow for these hospitals and said Congress needs to reform the program. To read our story on the report, visit ajmc.com. America's view of the pharmaceutical industry has taken another dive, according to a recent Gallup poll, and those with a negative view now outnumber those who view the industry in a positive light. Just 35% of Americans have a positive view of drug makers, down from 40% in 2014. Meanwhile, the share of those with a negative view has gone up from 36% to 43% in the past year. Jim Norman of Gallup noted, prescription drug prices continue to rise in the U.S., driven partly by the introduction of specialty drugs that can cost as much as $150,000 annually. With few indications that costs will stabilize soon, this issue has moved back onto the national political scene. HHS Secretary Sylvia Matthews-Burwell this week announced that health centers around the country will receive $500 million through the Affordable Care Act to provide primary care services to those most in need. Funds can support outreach and enrollment activities for the next round of open enrollment that starts November 1st, as well as help consumers understand if they are eligible for Medicaid. Burwell estimated that the health centers will assist 1.4 million people, allowing them to expand hours, hire dentists, and add more behavioral health staff. The annual policy summit of the National Comprehensive Cancer Network featured panels with Dr. Kavita Patel, Dr. Scott Gottlieb, Dr. Michael Koliger, and the editor-in-chief of Evidence-Based Oncology, Dr. Joseph Alvarez. The summit on value, access, and cost of cancer care addressed the value proposition in oncology as the cost of therapy continues to climb. Dr. Kavita Patel discussed how difficult it is to define value. You want to define value, and yet we don't know what that is. With the complexities of cancer care, insurers too are struggling with what it's going to look like. For additional coverage, visit ajmc.com. For the Managed Markets News Network, I'm Justin Gallagher. Thank you for joining us.